Do you have a pinching in your groin? This is a hip joint. It's made up of the femur and the acetabulum. Sometimes we can get impingement, and hip impingement is also called femoral acetabular impingement. And impingement just means there is a pinching happening. A pinching can happen because if the acetabulum has a bony growth that is growing over the head of the femur, every time you lift your leg, it pinches. You can also have sometimes changes over the shape of your femoral head. But in some of my women that have femoral acetabular impingement, some of these women were born with hip dysplasia. Some of these women are athletes. Sometimes you can experience something called a labral tear, which the labrum is a cartilage seal that helps keep the integrity of what is called the synovial joint. It's not uncommon that women who are athletes and women that have hip dysplasia will get some of these symptoms as they age. And it's not uncommon that women are getting hip replacements at the age of 45. Now the hip is interesting because when you start to develop hip pain, sometimes it can come on so increasingly fast, women can't believe it, that they could walk into Target, be fine, get to the back of the store, and all of a sudden they can't walk. When a hip gets a flare, it can be very big and last weeks. Other ailments of the hip, there is very common that people will be diagnosed with greater trochanteric bursitis, but actually 80% of greater trochanteric bursitis is technically glute med tendinitis. Tendinitis is when a tendon gets inflammation and gets micro tears. Every tendinitis is micro tears. Glute med tendinitis is no exception, but sometimes those micro tears can become bigger tears, and that's when it's a problem. Oftentimes, I like to think of the glute med as the rotator cuff of the hip. If you have exquisitely tender, painful hip, if you have tried rehabbing it, if you still feel exceptionally weak, you might have a glute med tear. Glute med tears are very, very painful, and they can be seen in a diagnostic ultrasound and MRI. Now, women who are pregnant will have hip pain, but it's not always pathological. It's because they have relaxin coursing through their veins, making their pelvis come apart, and so their hips feel loose and their pelvis feels loose. But after they give birth, if you rehab it, we can snug it back up, but that is a chemical-mediated relaxation. As women's hormones change, as you become perimenopausal, menopausal, postmenopausal, you experience more widespread joint pain because you don't have as much lubrication in your joints. So therefore, you're getting to be worn down, more tired and painful, and you have more inflammation. Plus, you've lived longer, you've done more things, you've walked more, you've done more, there's a little more wear and tear. Hope this helps. Hit the plus sign and follow for more women's health tips.